Hi, my name's John Wasson, and I'm speaking for my colleagues about the Institute for the Ideal Medical Home. As we all know, almost a decade ago, the Institute of Medicine, through its landmark report, Crossing the Quality Chasm, talked about the many needs and deficiency of the United States healthcare system. Since that time, a patient-centered medical home has become quite popular as the means for crossing the chasm. But, as we all know, there's not been an easy-to-follow blueprint for this medical home, and current blueprints are exceedingly vague about how the medical home will be patient-centered. The Institute for the Ideal Medical Home has been designed to bring you that blueprint and show you in an easy and enjoyable way how to build a patient-centered medical home. Perhaps this slide is reversed in that results precede the methods, but were there no positive results, we never would have established the Institute for the Ideal Medical Home. The graph at the left illustrates the difference, for example, in patients' report of care quality for past participating practices versus the U.S. average. We have many such measures, and measurement is indeed a critical component of our ideal medical home work. The work builds on the Institute for Healthcare Improvement's decade of experience and also many years of work in small practices and medium-sized practices throughout the United States. Underlying the Institute for Ideal Medical Home work are the principles of microsystem and the chronic care model. But frankly, in the curriculum, you will not see these emphasized because it is less important to understand global models and principles than it is to be able to act on them. This slide here shows the planned care model for those of you who are unfamiliar with it. Basically, it's a result of a literature review performed by Michael von Korff and Ed Wagner and others quite a few years ago, where they looked at all the components of healthcare that possibly could improve patient outcomes. And what they found was that indeed the final common pathway seemed to be in a productive interaction between an informed, empowered patient and family and a prepared and proactive practice team. The bubbles above the productive interaction in these players indicate the system and community supports that are necessary to make it work. And the challenge has always been, okay, I understand the model, how do I make it happen? At the same time, there's been work by Paul Batal, Gene Nelson, Margie Godfrey, and others on microsystem work, which in essence focuses on the means to make the planned care model work. We build on both of these in the ideal medical home work that we're about to present to you. Our prior experience enables us to anticipate many of the barriers that practices will encounter and offer workable solutions. And wherever possible and whenever possible, we have published these results and constantly tested them to make them highly efficient for practices across the United States, whether they are large or small. In fact, one of the publications brought to you by the Journal of Ambulatory Care Management summarizes 10 years of experience by the IIMH and is indeed critical for the efforts that we'll be taking together in this course, and we'll be urging you to review them. The curriculum has been designed for distance learning and busy learners. It entails the use of brief YouTubes for overview of each session, one-click downloads of PDF, easy-to-use conference calls you can attend from anywhere, email listservs to communicate with your peers, and plug-and-play technologies such as How's Your Health to maximize the efficiency, effectiveness, patient-centeredness of your practice, and at the same time support the patients. At a global level, the curriculum works on the so-called PDSA improvement format, except the P has been pre-planned, pre-tested, and pre-measured by many before you. So you begin with components and technologies of a patient-centered medical home that have been well tested and methods that have also been shown to maximize the value and safety of care. These are made available to you. Your job is to apply them to practice, document what works and doesn't work, study the results using listserv and conference calls, read about solutions, and then, based on your study, make these methods and components and technologies work and extend them to new sites, new technologies, beyond the time limit of this course. In fact, this course is part of a journey. It is certainly not something that you end after 6 weeks and go back to business as usual. For example, here's work by Lynn Ho, where even though she started much higher than the national standard shown in the blue dot on efficiency, when she started, she now had the tools available to her to document changes in her practice over time, and she continues to be a tremendous self-learner, like over 50% of the practices who take this curriculum. The pre-work activities that you will do are surveys, a very simple staff survey consisting of 7 items, 1 patient question consisting of 1 item. You can do an overhead optional survey to compare yourself to practices. We ask you to view the How's Your Health YouTubes, customize your How's Your Health, have your staff complete it, begin to offer it to patients. We ask you to download the PDF for the first call. And finally, check out the contents of the Journal of Ambulatory Care Management issue about IHI experience. Then come on to the first call where we'll review the baseline staff and patient questions, the why and how of How's Your Health, 10 slides that other practices who've come before you have found extremely important for success of a course like this. And finally, we'll lead you to the why and how of segmenting care and planning resources to greatly improve efficiency of care. Your one-stop shop for Ideal Medical Home is your practice page. You receive the code and password as you sign up for How's Your Health. You use this to come on to the site, and it gives you group news, upcoming events, the curriculum, your checklist and homework that has to be done before the next call. And finally, in real time, you can see how your patients are completing your How's Your Health surveys, and you can actually click on this to get your overall results. That's all there is to this course for your pre-work, and we look forward to working with you over the next month. Thank you.